Hello, very good morning. First of all, I wanted to thank you for this virtual meeting. I wanted to thank IPD. I appreciate the chance to share with you this opportunity. I am Ricardo Recena. I am dedicated to oral rehabilitation. I am a dentist and I am accompanied by my friend Luis.
Hello, how are you? Good morning. I join the words of my friend and colleague Ricardo. I am a dental technician. I have been in the profession for about 28 years and I am also dedicated to oral rehabilitation.
What we bring today is a content that we want to show you a little bit. How to make the difference. What details make the difference. Our expertise lies primarily in the areas of implantology and prosthodontics, ensuring that we consistently strive for excellence. Obtaining excellence in all treatments is our constant goal. However, setting parameters and establishing a workflow are imperative in order to achieve this. The flow that we will use is going to be the digital flow. What we want to bring to you is why we do this and how we do it. How we make things easier with the digital flow, whether it's in the clinic or in the lab. We know that in today's day and age, change is very fast. I mean, the world brings an uncertainty of what's going to happen because the changes are so fast that it is sometimes difficult to keep up. And what we know is that technology is here to stay. I mean, a 70-year-old person. Now we go to the restaurant and he needs to know about technology because if he doesn't, he can't master an iPad to order his menu. He can't eat because of it. So this is happening across the board, but also consumer habits have changed. I mean, our patients have changed, the prosthetists have changed, and the dentists have changed. And the field of dentistry has also undergone changes. Our consumer habits have all transformed. Instant gratification is what we seek. The need for speed has become inherent in us. Our desire for speed shouldn't compromise the level of detail in things. We crave personalization as well. Thus, an ideal solution would encompass both speed and personalization, but also quality. How do we achieve this today? That's what we're going to tell you right now. Our clinical needs have changed. We must meet the needs of a patient who has changed and now has a higher demand than before. They require more attention and care. So we have to understand how to master the technology, what we need, what suppliers, what kind of equipment do I have to create to meet these needs. To meet these needs, we know that on one side we have the patient, on the other side we have the prosthetist and the dentist. It has always been like that. One side the prosthetist, the other side the dentist, and the patient in the middle. That is to say, there were lines of separation and communication. The flow of treatments was greatly complicated, causing significant disruptions. Now we know that technology has to be learned. There is a learning curve. What is difficult? That we get into it many times and it repels us a little bit. But we know that once we are in and we start to flow, everything gets better, whether it's for the prosthetist, whether it's for the dentist, or whether it's for the patient. So we're not going to talk about one side or the other. We are always going to talk about a circular environment in a team where things travel with speed, technology, precision, and quality. The consumption patterns, particularly among our patients, have undergone a transformation. It is imperative to address these requirements in a distinct and practical manner. Otherwise, we will fail. No matter how much art we put in, no matter how much better we make our prostheses, we will fail because the needs are not met. So, for this, our mission today is going to be to achieve and talk about excellence in dentistry. Today, we aim to illuminate at least one bulb in your minds, sparking a new idea or understanding, so that you will consider changes that will take you to a powerful level of dentistry. That is what we want to achieve with you. Excellence we are not going to treat individually, but success we are going to treat as a whole. We as dentists or as conductors initially, we know that this will change throughout the treatment, but we will have to achieve a perfect synergy between us and you. But we will have to achieve a perfect synergy between everyone, between the technician, between the environment, between our providers, between what we feed and what our patients need. And not only this, the people who accompany our patients also have to feel what we offer in the treatment. In order to truly grasp the quality environment we provide in our clinic, one must embrace and understand all that it entails. This is why mastering these aspects is crucial. Because success comes with perception. The patient's perception of what dentistry used to be was that a patient who is afraid, who is in pain, The person with an ontology that requires a substantial amount of time to accomplish tasks tends to feel dissatisfied. we should take into account what we have accomplished and the changes we have made during this period. By achieving mastery in technology and utilizing top-notch materials, we can create a powerful fusion between technology adoption and quality material implementation. At our facility, we focus on teamwork and ensuring patient satisfaction. However, one aspect stands out: excelling in all these areas. Depends on intelligence and knowing how to do to achieve something even more. Because we don't have to meet our patients' expectations. We have to surprise them. We have to work in such a way that when the patient comes out of there, they feel, wow, this clinic is different. And right now we can do that by using techniques that are easy to get into. Sometimes they're a little bit repellent because we've never done it. We've always been taking impressions of the implants with the transfers, silicone or all that. So now we are doing a digital entry with a very simple piece, which is the scan body. The scan body is your key to enter the digital implant world. How complex is it to work with? Well, nothing complex. You just need to understand some parameters that I will explain in this video. I will explain and you will agree with me. The digital flow in implantology starts from there. It starts by choosing a good scan body that is able to digitize this accurately. So it has to have a titanium base and a peak body. The screw should be securely tightened in a way that it consistently lands in the exact same position, allowing for radiographic inspection of the procedure. This reed head has to have a minimum tolerance. It has to have maximum precision for it, because if you don't, what you do in digital doesn't look anything like what the real thing is. And that was the problem when our dentists entered the digital world. That's why we also have two heights for those implants that are buried. Also the tolerance that you can have depending on the scanner that you use, because yes, there are also differences. We can correct in the software with more than 120 platforms. So any implant that is found can potentially be scanned using an IPD scan body. Now the question is, how should we proceed with the scanning process? We take an X-ray of this prepared and well-chosen part according to the height and depth of my implant. If it is very deep, I use the tallest one. If not, I use the short one that makes it easier for me to read. Here we screw it in. We X-ray and see that it is in position. Let's check that this is in position, otherwise all this work goes backwards. We have captured and digitized this patient, but everything that goes in front of it, which is a sequence of data that we're going to see there in the course of the talk, where the lab can actually flow with parts that are quality, but customizable means that Luis within the lab can have a very low stock of parts. He doesn't have to have 20 zero heights, because he's going to be able to customize these parts and he'll show you how to do it. So this is making the dentist's life easier, but also the prosthetist's life easier. We don't succeed if clinically we are doing very well and prosthetically we are doing poorly. In order to ensure quality throughout, the entire work must flow smoothly until the end, maintaining a consistent and high standard. And precision. If we miss a point, that's where we've lost. Effective collaboration is crucial. Selecting the right tools matters significantly in achieving success. It also counts that this is what seems complex at the beginning. This catalog full of parts that we have a multitude of parts to choose from. So, the next question arises, can we modify these components to have a smaller stock? In my opinion, there will definitely be possible approaches to achieve this. And that is the big leap that we see, customizable quality. So analog dentistry was this. A lot of time consuming. Why? Because in all of our tests and actions, we rely on the cooperation and endurance of the patient. So the idea is that by digitizing the patient, we essentially transfer the patient's information to the lab table. All the procedures that I normally perform on the patient can be done there too. But I have to be precise, because if not, the time you spend in the lab is not going to be worth anything in the clinic. And that's the leap we've made. To gain such precision that we are able to digitize the patient and do all the guided and precise dentistry from start to finish. We have to learn a new way of behaving. That's why we bring these virtual moments, so that you can grow from your clinic and learn the flow of everything. When we talk about single implants, for example, before, U-bucket, silicone, Plaster distortions, casting disorders, and design distortions are observed throughout. Now, what do we do? To a lady who at first seems to just want a piece to chew on, then here we want a piece to chew on. To chew on, then here I want a tooth to chew on. We can go further and achieve, in addition to all this, precision and aesthetics. What do I have to know? Which scan body am I going to use? Depending on the brand of my implant, depending on the connection I have. Whether single or multiple, I will choose a screw as the scan body in this instance. I create my check plate and get an X-ray. I undergo a scan before all the data enters a digital system, flowing seamlessly. So here you can see the different range of scan bodies that we have. You can see on each one that each one has a code. Knowing this code is crucial for Luis in the lab because it serves as the gateway to this digital realm, an essential key to unlock this virtual universe.
One thing that makes this very important is that he takes pictures with the reference looking vestibular. So when I get that print, the lucky thing I have is that I'm not going to make a mistake. Is that I'm not going to make a mistake with the habitat that I'm going to order.
So a simple photo and we write it down on the card, or we send this photo of the reference. Sometimes I have people who say, but the reference is too small. I can't see it, but I don't see it. I photograph it. I take a photo of the reference and it goes to the laboratory to be able to unblock the work. Here we see the different connections. This has to be a very high precision material. It's a chore to save effort here, as this marks our arrival into the world of digital technology, taking the first step. I inform Luis that this object is not just a tooth, but actually a precious gem, a jewel. It is a special stone that will be placed in the mouths of our patients so they can experience its beauty. To have a healthy mouth, but also a beautiful one, also with resistance, also with precision. So this is what we do. And notice that we give this back to a patient who simply wanted a tooth to chew on, but we can go further. And offer her a piece of jewelry for her to be so happy, to the point that right now this patient is part of the team. This patient brings me more people because we surprised her. We have achieved the wow effect above and beyond expectations. That's what we're going to want, and that's what we're going to get in teamwork.